I am so excited for our guest today. I cannot say this enough of how my countdown was happening. And I wanted to just give you some context. She recently became the executive director at Unsinkable. She is an outspoken advocate, a leader, and a change maker in our community, especially when it comes to mental wellness and mental health and disability as well. And so I really want to take some time to welcome Haley Hetchman, my friend, my ally in this work. So thank you so much for being here. I'm so excited for this
Thank
conversation.
you.
I'm so
Same
excited.
here.
Yeah, so let's take a deep dive. I want to kind of kickstart this conversation by just putting an emphasis on mental health in youth because it's not something that's new. It's
Mhm.
been an ongoing struggle, ongoing conversation, ongoing barrier for youth to access the appropriate support systems. And of course, especially with the pandemic when it happened, hopefully we're in post pandemic. I'm still not sure on some days. Um, it really amplified that this was a massive, massive gap that was happening in terms of access to support for youth, especially when it came to mental health and mental wellness. So, can you tell me a little bit about how it was in your experience, what you were seeing right when the pandemic hit, and where do you feel we're going right now when it comes to mental health and youth support?
Yeah, great question. I think I have seen a pretty significant shift, I think, over the last, I can't believe 4 years at this point since the pandemic started. When it comes to youth mental health, I think there's a lot more, like you said, a lot more conversation that started happening as a result of the pandemic. It really highlighted some missing aspects of the work that we were doing in the mental health space. Obviously, there's always been a number of resources available, great organizations doing fantastic work to provide um, clinical levels of support, to provide, different non-clinical interventions for young people. But having a greater conversation about the impact of mental health in an online space really became super relevant during the pandemic. And that's something we saw as an organization of more young people showing up online. Obviously, the access to in-person services was significantly decreased or didn't exist at all for a period of time. And many people still struggling to access in-person support given capacity of different organizations. I would say, what I've seen shift in the past few years is just more of a willingness to acknowledge the importance of conversations around mental health when it comes to young people and the intersectional nature of mental health. Obviously, mental health impacts people in so many different ways. We all are impacted in some form, but recognizing it is so interconnected to these different aspects of our lived experience, whether it be our work, whether it be school, whether it be our families. There's all of these different components that affect especially young people's mental health, but mental health across the continuum. I think another big shift I've seen is from an organizational perspective, more and more organizations willing to work together in collaboration to address, the gap that exists when it comes to mental health resources, whether that's, including different programs together or cross promotion or recognizing that this piece is only going to go so far. So being able to bring two organizations, expertise, resources together is going to have so much more impact and so much more reach. And I've certainly seen a huge desire in the mental health um, sector to come together and find collaborative solutions, which I think has been one of the positive benefits over the last few years is more organizations wanting to see solutions that are going to be sustainable and meet the needs of youth where they're at.
No, that's such a great point to make because there are, as you said, several organizations focusing on mental health. But if we're doing it on our own, we can be more effective together. So I love that shift that you've seen recently in an effort to be more collaborative, more creating that sort of community of practice to
Mhm.
just kind of gain advice or to support and to lift each other up in the work that is a common mission across the organization. So I'm really, really excited. So to your point, I wanted to ask you this because yes, there are a lot of organizations that are focusing on mental health support systems. What is the one differentiator between the other organizations and Unsinkable?
Yeah, great question. I would say for us, there's so many organizations doing great work. I really do want to acknowledge that in local context and national context. For us as an organization, our big focus is on activating storytelling as a way of encouraging people to access support. And I think a lot of organizations do storytelling as, a result of their work. They say, this is the story of the work that we've done versus our focus on firsthand storytelling. How are we sharing the experiences and lived experiences of people in our community in a way that recognizes their voice and gives them that platform to be able to speak to where they've been along their journey and how that can support other people. But on the flip side as well, one of the major, I think, differentiators for us is that youth-centric development focus, where our youth program in particular is developed by youth, it's facilitated by youth. The topics that we discuss around mental health and mental wellness are determined by young people's emerging needs and really wanting to center their experience and their voice and how we grow and evolve as an organization. That's something I think is so key to the work that we're doing and something that we want to continue to grow and evolve as they do, so that we're really keeping up with what is most important right now and how can we be a capacity builder for young people through our work.
Yeah, that's so incredible because, uh, yes, organizations want to focus on implementing change for youth and for the community to really focus on the future generation. But the one thing that you said to me, what really kind of stands out, is the involvement of youth being a part of that journey. And oftentimes that is not the case for several organizations. That's not the case. Where decisions are made and then it's been implemented, whether that is through a program or through a support system. And then at the end of the day, when it comes to kind of understanding the impact piece of a service or a support system, there's this concern because, oh my goodness, it's not working. Like, why is it not working? Well, to your
Mhm.
point, are you involving the people that we're really looking to impact in whatever that journey is, in the decision making process, in the design of the program, whatever that looks like? And are you actually actively getting feedback from the community on, hey, how are we
Mhm.
doing? Right? Because I feel like that is a critical component in any work that gets put into the community is, well, how are we doing? And also, who is at these conversations? Like, who are making these decisions on what is needed
Mhm.
for the community? And so,
Totally.
yeah, that's so amazing. And I love that piece about the power of storytelling because you're right. Oftentimes there's this aha moment where, yeah, let's speak about our work. Let's speak about our program. Let's speak about our support systems. Like, okay, well, how about we just shift the cameras and how about we kind of take it in from a perspective of the person who is going through this experience, who can talk and who
Mhm.
can relate to this, right? I feel like that still is a challenge and a barrier that several programs and support systems face. Not sure what the barriers, or perhaps it's a case of, well, how are we going to initiate this conversation, or how are we going to ensure that we're creating a safe space for a person
Mhm.
to come in and be vulnerable and feel safe to share their story. So, what are the steps that Unsinkable does to create that space for folks that are really wanting to and willing to share their story?
Yeah, I would say there's a number of different things that we do in order to engage, creating that safe space. I think one of them starts before we even interact with someone who's interested in sharing their story, which is modeling, that storytelling approach as an organization and as a team. I've shared my story. A number of people who are working within the organization, our founder shared her story. That's how the organization started in the first place. And so really wanting to model the importance of those vulnerable conversations and say, we're willing as an organization, as people within the organization, to share our stories openly as a starting point. I think that creates a lot of safety
Yeah.
to, when we connect with a potential storyteller, really getting to know from their perspective why they're interested in sharing a story, doing a bit of a assessment of where are they at right now, what are the relevant pieces that they would like to share, how do they want their story to be received? Is there someone, along the journey that they're thinking about would really benefit from hearing their voice, and how do they want to connect with them? So really taking that approach of really getting to know who they are and how they want to share their story. Having multiple modalities to be able to do that is super important. So if someone wants to share in writing or in video or in an interview, like having a number of different ways that they can share their story, because not everyone wants to do that in the same format. Not the same format's not always accessible to everyone.
Right.
So giving those options is a big piece. And then lastly, I think a big part of what we're trying to continue to do and evolve as an organization is recognizing storytelling at different points in the continuum of not just telling stories that feel like a before and after of this person was really struggling, now they're doing amazing.
Yeah.
We know that that's not the case for so many people, and that we're going to go through ebbs and flows, and that mental health is not linear. And so being really mindful when we're sharing stories to capture people at different points within their mental health journey, so that we're speaking to, authentically speaking to this living experience versus this, snapshot in time. So I think that's a big part of it as well, of recognizing it changes and evolves as we go, and wanting to honor that.
Yeah, no, that's fantastic. And it's so interesting to me because I read stories and articles oftentimes as it relates to mental health or folks that are seeking out help. And there's so much emphasis on this is what I struggled with, or this is what the person struggled with, and now look at them, right?
Hmm.
But it's not that easy. Oftentimes, to your point, it's a progression, it's progress made, whatever that progress looks like for that person or for folks. But we don't have to focus on that. For some reason,
Hmm.
there is this stigma of no, no, let's not focus on someone falling back or having a bad day in their journey through their progression. Well, if we talk about it, to your point, more and more people can relate and to say, okay, you know what?
Hmm.
Yes, today was not a good day, but that's okay. I'm still progressing. I'm still evolving. I'm still working on myself. Right. And
Hmm.
that's okay. That is fine.
Hmm.
That's like the authentic, to your point, the authentic story of that person, of that individual's journey. And we
Hmm.
need to put a lot more emphasis on that journey than we are right now.
Totally.
So that's wonderful to hear, and I'm curious to hear your thoughts on this. What have been some of the challenges, the known or even the unknown challenges that you faced, in the introduction of storytelling through Unsinkable?
I think, challenges from my perspective, a big part of the work that we do is connecting with people. So, having a wide variety, like I said, of stories at different points in time is so important. Now, a challenge in that is someone feeling willing and ready to share their story when they're in it with their mental health, because that's sometimes the point where people are going to resonate the most. They're going to feel the most connected to someone, but it's also really hard to reach out
Mm.
when you're in that headspace. So being able to provide that level of safety to give people, the space to share whatever feels most comfortable to them, however much or as little of their story that they want to share. I think that can always be, a tough area to navigate. And we want to do that with support and with grace and with empathy for where people are at in their journey. So I say that would be definitely an area that we're continuing to think about intentionally. How do we do that in a way that's both engaging someone in the midst of their recovery or through the midst of their struggle at this moment, while also recognizing that there's a lot of emotion that comes along with sharing your story while you're, processing it, and while you're still kind of in that space. So that's one piece. I think the other piece for us when it comes to maybe challenges that we face when it comes to storytelling is, wanting to share a story that is going to support someone to connect with resources. So really wanting to make sure, are there things that has worked well for someone along their journey? Have they sought, whether it's clinical or non-clinical interventions, family members, crisis lines, whatever it is, being able to amplify and emphasize that there are supports that are out there. And we're not a clinical provider. So if someone reaches out to us wanting those
Right.
services, we're not able to provide that. So making sure we have an up-to-date list of resources and referrals that we can provide to someone who really resonates, making sure that that warm handoff is there so that they can connect with the help that they need.
Yeah, that's such a good point to bring up because you don't know, right, what folks are going to ask once they hear a story or once they listen.
Mhm.
Um, oftentimes sometimes it is a call for help, but to your point, like we need to ensure that we have the support system in place to do those referrals to folks, and we're not letting them down by saying, oh, we don't do it. Right, it's like,
Mhm.
well, what is the
Exactly.
solution that we can provide them? Because oftentimes, based on organization capacity, that is sometimes a response because you don't do that type of support, right? So when folks are kind of reaching out, and I love that piece about how can we support the person. So yes, they said yes. Yes, they committed to this conversation, but perhaps that day is not a good day for them.
Mhm.
Perhaps, to your point, they're still recovering. Perhaps they are having a panic attack or an anxiety attack, whatever that looks like for them. How can we best support them? And
Mhm.
sometimes the person who's doing it may also take it a hard hit on themselves to be like, oh, okay, I know that I committed to them. I feel bad. I am a horrible person. And we start having this dialogue in your
Mhm.
mind, right? I mean, even for you, remember I was like, yeah, I can't do it today. Can we change? And then
Mhm.
there's this dialogue that goes in your head and be like, oh my goodness, like, am I like, is that bad? Like, like what is that conversation that you often have with yourself? And you need to have that support system in place where someone's like, hey, it's okay. You're good.
Mhm.
It's not a good day. It's fine. Let's figure it out together, or whatever that looks like. And oftentimes that doesn't happen. And I love that piece that Unsinkable provides to folks that are really looking to come in and create that safe space and be vulnerable. So that's really amazing.
Mhm.
And so, what are your hopes? I guess I know that 5 years down the line is a lot to think about, even 2 years down the line sometimes. So let's go with two. So, I mean, what are your hopes, like 2 years down the line, for the work that you folks are doing?
Yeah, great timing for
Yeah.
this question because we just approved our 3-year strategic plan, so I can give you kind of 3 years down the line of what we're hoping to achieve. I think there's a number of areas that we're looking to focus on. I think we had identified 5 priority areas in our strat plan, but I'll speak to 3 of them that I think are most important for us moving forward. One of them is around cultivating community, and we did a stakeholder engagement back in the fall to develop out our strategic plan. We really wanted to hear from those within our community what's working well, what's not working, what should we expand upon. And community was a big aspect of that, of being able to not only share stories, but also bring people together around those stories. So doing more events, both in person and virtual, bringing that sense of connection between storytellers. There's something really powerful about sharing your story and being able to share that experience with someone else who's gone through that same process can be a really great point of connection. So bringing those storytellers together is an area that we want to continue to build out. Another big part of our strategic plan is around amplifying diverse voices and making sure that we're calling attention to all these different aspects of mental health in different communities across Canada, and not only the individual stories, but also the stories of organizations that are local organizations that are working across Canada, and how can we encourage a spotlight on them for the work that they're doing when it comes to supporting specific communities and taking a culturally responsive lens to the way that they address mental health, or really thinking about the types of communities that they're engaging in. How can we really be an amplifier to the work that they're doing? So that's a big part of it for us as well. And then lastly, I would say one area that we've identified through our plan is around embracing thought leadership of people with lived experience and really wanting to create more rooms where people can share. These are the interactions that I've had with, whether it's clinical care, whether it's medical care, whether it's, research, whatever that may look like. How can I, through my lived experience, inform changes to those systems by providing feedback around what my interaction looked like, and really putting the focus on to people with lived experience as having an expertise on what that interaction, that journey has looked like for them, and being able to inform decisions that happen within our healthcare, mental health care system based on what we're hearing directly from those patients, those consumers, those clients about what it was like to go through that process. So that's definitely another area for us that we want to continue to build out. But partnerships, community, amplifying stories, really that's our main priorities going into the next couple of years.
Yeah, no, I feel like that's perhaps even the heartbeat, right, of Unsinkable is
Mhm.
keep that going. And the more stories, the more folks that share, the more folks that you're helping out or folks are helping out, right? And it's just an
Mhm.
amazing um, mission, amazing collective, I would like to say. And I'm just so excited for this journey to see how it unravels and more over the next few years. So and I'm so excited for you and the work that you're kind
Thank
of
you.
and embedded in, and I'm really grateful for this conversation. So I'm really excited to see what happens. And yeah, thank you so much for sharing this and more on what's happening. And I'm really excited for what's next for Unsinkable.
Thank you so much. Yeah, it's great to share, and look forward to coming back maybe in a couple of years and telling you where we're at.
Yes, love it, thanks, Haley.
Thank you.